Hi, folks. My name is Dr. Joel Richnak, and I want to welcome you to our webinar today regarding a topic that I'm very passionate about, this world of regenerative medicine, and how we're finding it to be a very extremely powerful tool to help people get back to moving, and in addition to help them prevent and avoid surgery. Now, a little bit about myself. I've been in practice now for over 17 years now, and I'm double boarded in both physiatry, which is a neuromusculoskeletal specialty, as well as sports medicine. I'm also a managing partner in our clinic here in Grass Valley, Mountain View Rehabilitation, along with my partner, Dr. Mike Jensen. I've been a regenerative provider for 5 years now. To be fair, I've been practicing regenerative medicine for ever since residency, so over 17 years now. In that I've been doing, offering what we call prolotherapy treatment, which is something many of you are probably familiar with, and something I'll explain a little bit more a little bit later on. Something else about myself is I have a very active lifestyle. I enjoy many activities. Help me explore the mountains in goodness here in Nevada, of which I've been living in most of my life. And being active, obviously I've gone through my own injuries and setbacks and what have you. And therefore I feel that this has given me a very unique perspective from the standpoint of I understand what it takes to go through the rehab process. And I certainly understand what it's like to be taken away from activities that I enjoy. And that in large part has shaped my treatment philosophy, which is here in our clinic, we have a real passion for getting people back to moving, getting them back to doing what they want to be doing. And that's something that we experience on a daily basis and find very gratifying when we're able to successfully do that. Now, why are you folks here? Well, many of you are here because you are having your own pain issues. You've had your own injuries, your own setbacks, and are consequently going through your own downtime. Some of you have already gone through the conservative treatment and have been told that your only other option is surgery, and you're hoping to avoid that. Or you've been told that you're not a surgical candidate at all. Or you're just simply looking for options, or don't want to rely on medications to help to address your issues. Or most importantly, you want to get back to the active lifestyle that you once enjoyed. So today we're going to talk about a few things. We'll start with just briefly going over current historical options in orthopedic care. And then we'll spend some time talking and introducing this world of regenerative medicine and a newer medical specialty, interventional orthopedics, which really has increased the success of regenerative medicine substantially. And then we'll spend some time talking about this company, Regenerative, and why they are such a far different clinic than any other clinic offering this type of treatment. And then we'll spend some time clarifying some of the misconceptions of some of these products that are labeled stem cell, but are something else entirely. And then we'll spend some time in a question and answering session. So current options in orthopedic care include medications, conservative treatment, and of course, surgery. So many of you, if you become injured or experience some sort of pain issue, start the process by taking just over-the-counter medications, whether it be Tylenol or ibuprofen, in hopes that this will help you recover and get back on the trail, so to speak. However, if that doesn't quite address things, then oftentimes we'll go see our primary care physician, at which time we may be prescribed a prescription strength medication, whether it be anti-inflammatory, opiates, or steroids. Ultimately, however, vast majority of the time, this proves to be a temporary band-aid at best. And of course, we all know all the various side effects that can potentially occur from medications, and something we're learning more and more about each and every day. And then the next step oftentimes is conservative treatment. And as a physiatrist, I work very closely with other physical therapists, and I really do believe in the rehab model, who share the same treatment goals that I share, which are first and foremost to try and address the pain issue, and once addressed, followed by training in the rehab process, which really is critical for this process can help address the mechanical deficits that oftentimes contribute to the pain or injury itself, or frequently exacerbate the issue. And therefore, the rehab model tends to be the long-term fix. Of course, there's other conservative treatment options, including chiropractic treatment, acupuncture, massage, and at times we even use bracing. If the conservative treatment fails to address the first goal of addressing pain, then sometimes we'll resort to injections. Frequently we'll start with, say, a steroid injection. And again, sometimes that's effective at addressing the pain to allow and enable the rehab process to take place. But many other times it proves to be just a temporary relief. And many of you are familiar with other injections, including hyaluronic acid injections, which sometimes we use specifically for knee arthritis. But again, we're learning that steroids have side effects, and more we're learning that if given too much of it, it can be detrimental, meaning that it can actually make arthritis worse, or in the case of foreign tissue, can make that tissue more brittle and more prone to further tears. And then historically, if all else fails, oftentimes we'll be referred to a surgeon to get surgical opinion, in which whether or not we might be a candidate for a replacement or removal of tissue or repair. Now, the interesting thing about surgery is over the last 5 to 10 years, there's been more research regarding surgery than there has been in the last 50 to 60 years combined. And much of this research is telling us that there are many surgeries that can be ineffective. And of course, we know the risks, not only of the surgery, but the anesthesia. And in some cases, they offer temporarily, but in the long term, it doesn't really work because the pain either returns or the surgery itself causes a different pain issue. And then, of course, once done, it can't be undone. Now, diving into the research a little bit more, we've discovered that, of course, many surgeries are effective and medically reasonable and necessary. But interestingly enough, only 40% the research shows that only 47% of the time that occurs, which means the majority of the time we're finding that the surgery itself was inappropriate or ineffective. And because of this, I'm very excited to present the rest of tonight's topic, which is introducing this world of regenerative medicine, which in a nutshell is basically using our own cells, namely platelets and stem cells, to either reboot the healing process or address symptoms related to degenerative changes. So more specifically, we are finding that the use of these cells is very effective at repairing injured tissues, namely tendons, ligaments, meniscal tears, labral tears, and even in the cases of disc herniations or nerve injuries. In the case of arthritis, we're also finding this a very effective tool to address and alleviate symptoms and restore functionality related to arthritis. What can be treated? Here in the clinic, we treat all orthopedic conditions, whether it be knees, shoulders, hips. And as you can see, in each joint, there's various issues that can and is treated. We also treat all areas of the spine, elbows, hands, thumbs, and of course, feet and ankles as well. What is interventional orthopedics? Well, in a nutshell, we're finding that interventional orthopedics is really essential in terms of verifying the success of regenerative medicine. And what it is basically taking and being able to place these cells very precisely in the site of injury using guidance. Now, the correlate to interventional orthopedics is interventional cardiology. Now, many of you may remember that at one time, anybody getting a heart procedure would visit a cardiothoracic surgeon who would need to basically remove part of the chest wall to expose the heart in order to offer treatment. Interventional cardiologists invented a technique where they can introduce a catheter into a vessel in the leg, and from there, guide that catheter up to the heart using guidance, using specifically fluoroscopy. And upon getting to the heart, being able to offer treatment, whether it be placing a stent or removing tissue. And again, interventional orthopedics is very much the same correlate, meaning that we're using guidance to help place these cells via a needle, very specifically in the area of injury or in the degenerative arthritic area. Now, the other correlate to this is ultimately interventional cardiology replaced 70 to 80% of what cardiothoracic surgeons would do. The leading minds in regenerative medicine really believe that in the next 5 to 10 years that this technology, this treatment option will replace a good 70 to 80% of what orthopedic surgery is doing now. Now, diving into that a little bit further, anybody who's offering orthopedic care, whether it be an orthopedic medicine specialist or orthopedic surgeon, provides injections. The vast majority of these folks, 95% of them, are doing what we call simple injections. And what that means is they're basically putting the needle in the general area of pain, injecting and hoping that that medication magically gets to the area of injury or the area of pain. They won't necessarily provide a very specific diagnosis. They're just trying to do a general injection. Now, with the advent of technology, more and more clinicians are introducing ultrasound imaging to their clinics. And this can help get the injection a little closer to the area of injury. But again, many times they're not necessarily targeting a specific structure or delivering it precisely to that area of injury. In the world of interventional orthopedics, which comprises just 1% of all these physicians, first and foremost, that the interventional orthopedist is making a very specific diagnosis, recognizing that there's many tissues within a specific joint, and using the image guidance to help deliver the injectant very precisely to the area of injury. So in the case of a hip, they recognize that there are many tissues that could potentially be causing pain or a multitude of tissues. And therefore, by the diagnosis, they verify what exactly is causing the pain, and then again, are able to deliver the treatment very precisely, again, with image guidance, to either one of these tissues or a number of these tissues. Now, the same holds true in the case of a knee joint, as well as a shoulder joint. Again, multiple tissues that could potentially be contributing to the symptoms and therefore require treatment. What do we inject? Well, another word for these cells that we're injecting is orthobiologics. And under the umbrella of orthobiologics are concentrated platelets, platelet lysate, as well as stem cells. Now, platelet-rich plasma is a procedure where essentially a blood is taken, and then once the blood is drawn, it goes to the lab where it's processed into a very concentrated platelet solution. And we're finding that platelets are a very powerful healing tool. A platelet is essentially a cell, which means that it has a membrane, and inside the membrane are various proteins, including growth factors and cytokines, which, as you can read there, are very powerful healing tools. And we're finding that this procedure works very well for any type of tissue tear, whether it be tendons or ligaments, or in the cases of mild to moderate arthritis. Platelet lysate is a platelet product where the membrane itself is lysed. And what that does is it provides immediate release of all those proteins that we had mentioned earlier, the growth factors and the cytokines. And delivered in this manner, we're finding that this offers a much more powerfully anti-inflammatory effect. But in addition, does have the growth factors to provide repair. And we're finding this particularly effective for addressing nerves, whether in the case of a radiculopathy or a nerve compression, such as carpal tunnel. Now, our most potent tool is stem cells. And stem cells work by a couple of different routes. The first is that if you deliver a stem cell very precisely into a tissue, whether it be a bed of cartilage or a tendon, the idea is that that tissue, once embedded in those cells, can transition and differentiate directly into that tissue, so provide the direct mechanism of repair. The other aspect is stem cells act kind of like a general contractor in that they communicate and correlate with all the various other players, if you will, that are involved in the healing process, and then bring them to the site and work in a synergistic manner to, again, provide that healing stimulus and over time repair tissue. We obtain stem cells from bone marrow, which we get from the back of the pelvis. And we're finding stem cells particularly effective in the cases of more severe arthritis, or if we have a more severe tear affecting tendons and ligaments. Now, the breakdown of our procedures is 80% of what we do is platelet injections, which means that only 20% of the time we're doing stem cells. And that's significant, simply because the most important part of treatment is using the right tool for the job. And we're finding that platelets, the vast majority of the time, are all that's needed. And the significance of this is that there's a significant cost difference between the two procedures. Not everybody needs stem cells. And in addition, the platelet is a simpler procedure. It's a less invasive procedure. Now, talking a little more about this company, Regenx. Again, I've been an affiliate with Regenx for over 5 years now. And Regenx, in a nutshell, truly is one of the pioneers, if you will, in regards to the world of regenerative medicine or orthobiologics, as well as interventional orthopedics. Now, to be fair, they were the first clinicians to offer this in humans. Much of what they learned, however, came from the equine world. The equine vet world has been providing this treatment to horses now since probably the late 80s, early 90s. So much of the research and foundation that was introduced by the vets, and this is how we correlated and transitioned to using this for humans. Regenx is a far different approach and a far different clinic than the vast majority of clinics out there. And in multiple ways, particularly in regards to experience, clinical research, lab research, lab platform, image guidance, data registry, specialists, cell source, harvesting techniques, as well as dosing. So these are all areas that Regenix really is far different than any other clinic out there. So jumping into that a little bit deeper, as I mentioned, Regenix has been doing this for over 15 years, and which leads to experience, and experience in regards to technique, processing, research. This all ultimately results into greater outcomes. The more experience one has, the better, the more likely you're going to succeed from that specific treatment. Our lab platform is far different than any other clinic. Most clinics who offer this technology are using a bedside centrifuge. And what that means is they collect the tissue sample, whether it be blood or bone marrow, or in some cases fat. They place it in tubes, enter it into the centrifuge, and then hit a button. And what that means is that when it comes out the other side, it's basically the same tissue, the same dose for anybody and everybody who's getting that procedure. Now with our platform, not only do we have a bedside centrifuge, but we have a full-on laboratory hood and all the various tools that are required for processing. And what this means is that we customize each and every sample to the individual. We recognize that there are different concentrations that we can strive for, different dosaging, different quantities. So everybody is treated as an individual. And again, ultimately, this results into greater outcomes. The cell source that we use specifically for stem cell is bone marrow. And bone marrow has been proven. It has been the most researched by far. Its safety profile has been measured, and probably the most intensive area of study, and has proven to be a very, very safe, as well as a viable source of stem cells. And most importantly, it is the only source of stem cells that the FDA recognizes, which means that any other source of stem cell is essentially illegal. So source is important. Now at Regenix, we have developed harvesting techniques because we've learned over the course of over the years through our experience that the number of cells, when it comes to stem cells especially, is critical. The more we can get, the better the success, the better outcome. So we have developed techniques in the harvesting process that really allows us to optimize these numbers. We do it a little bit different than most clinics out there because we have discovered that our technique really does for the greatest concentration, the greatest dosage, and again, this results in the greatest success. Further diving into this world of dosing, at the end of the harvesting and processing of the stem cell, we have technology that actually measures the amount of cells we actually have. And this is important simply because many times we're trying to treat more than one joint. But we only do so if we have proper dosing. And we have found that through our harvesting techniques that we are getting the amount of cells that we need for more than one joint the vast majority of time. Again, dosing is important. If we don't have the appropriate dose, or I should say we ensure that we have the appropriate dose to optimize response to that specific joint. Now we've discussed quite a bit already the importance of guidance. Again, we strongly believe that guidance is critical. Without placing these cells very precisely into the area of injury, we're just not going to be successful with this technology. So again, the right guidance really is the difference between success and failure. Now, jumping into the data, anybody who goes through a Regenix procedure is invited to join our registry. And what that means is each individual is followed over the course of time so that we can measure outcome as well as side effects and other information. And ultimately, we have a data bank of over 20,000 patients, which is one of the largest data banks in the world. And this has fed much of our research. And this is an important point to expound upon further, in that this world of regenerative medicine is still a very young world. We're still learning a lot. And therefore, research is critical, not only in terms of optimizing what we have, but again, in terms of proving that this technology works. Now, our clinical research, again, this is fed in large part by our registry. And Regenix has published the vast majority of research out there. Regenix is one of the only clinics who has really put a lot of their energy and time into doing research and offering the results of that research, not only to patients, but to all clinics out there. And again, from this, we can assure its safety and its effectiveness and provide you with honest information as opposed to simply giving you case studies, which may not be accurate. Now, Regenix has, in our headquarters in Colorado, basically a university-sized laboratory filled with scientists who are constantly working on the processing. And again, because this technology is still young, we're learning so much, and we're still trying to figure out the best ways to optimize effectiveness of these cells. Consequently, that means that today what we're offering is much more powerful than we were offering probably 10 years ago. And again, in the next 5 to 10 years is certain to be even better yet. So again, we're always working on trying to get the most effective treatment protocols available out there. Now, we've touched upon a bit on the importance of specialists. It's important to understand that a number of clinics out there are not necessarily specialists, meaning that they're generalists or they may not be a physician, maybe a nurse practitioner or a physician's assistant. Anybody who's under the Regenix umbrella is a musculoskeletal care specialist that is trained very precisely in musculoskeletal care, as well as in interventional orthopedics. Again, experience does make a huge difference, and again, hopefully is the difference between success and failure. Now, our procedural flows go as so. In the case of a platelet injection, before we even do the procedure, we see the patient for an hour, do a very thorough evaluation, listening to the history, going over the radiological studies, doing a very thorough clinical examination. And from this, we are able to deem whether or not that patient would be a candidate. And if they are a candidate, give them a good idea of what they can expect at the end of this in terms of prognosis. A rehab course. Again, oftentimes there's a lot of work in terms of training that individual in various exercises which can help restore proper biomechanics. And we're finding that if that's not done, if we're not correcting these biomechanics, and oftentimes the injury reoccurs, or the pain issue just simply returns down the road. And then we see each and every patient 2 to 3 months after the procedure just to see how things are going. Now, the stem cell procedure is very much the same way, in the sense that it starts with a very thorough initial evaluation to verify if they're a candidate or not, as well as to provide a prognosis. And then, if scheduled for the procedure, the stem cell procedure is comprised of 3 different procedures over the course of 5 days. Now that starts on day 1 with prolotherapy. And prolotherapy is just simply injecting the irritant into the tissue. And what that does is creates an acute inflammation, or basically reboots the healing foundation, if you will, and prepares the tissue for the stem cell. The analogy to that is it's tilling the soil for the seed. That patient comes back 2 days later, where we do the stem cell procedure, and that starts again with the aspiration. Once the aspiration is completed, it takes about 3 or 4 hours to process the bone marrow into a very concentrated stem cell and platelet solution. And 4 or 5 hours later, they're brought back for the injection. And again, the analogy to this is we're planting the seed, planting that stem cell very precisely into the area of injury or the area of need. And then, in addition, also injecting platelets. 2 days after this, we do additional platelet injection, at which time we get that from a blood draw. And we're finding that platelets are very important to add to stem cell, simply because they provide all the nourishment, if you will, the growth factors and the cytokines that the stem cell needs to optimize its healing response. And again, that's followed by, typically by a very vigorous rehab process and a follow-up after 2 months. Now, switching gears, we'll spend a few moments talking about the stem cell hype. And what we're finding is one of the biggest culprits in regards to this hype is this world offering, these clinics offering amniotic or placental or cord, quote unquote, stem cell injections. Now, I say quote unquote simply because there have been many studies regarding this product, all done by very reputable universities, who essentially discovered that this is simply a dead tissue product. There are no live stem cells. And the reason for this is, in order to take tissue from another individual and being able to offer that to a different individual, there has to be a sterilization process, which requires boiling, followed by a flash freezing of the product. And that essentially is killing all viable cells. And then the importance of this is the FDA has recognized this as a dead tissue product. So anybody, any clinic who is offering this as a live stem cell treatment is essentially creating fraud. And this is important simply because the FDA is finally is imposing this regulation, and consequently, just in the last year or so, they have shut down many clinics who are creating this fraud. Now, to be fair, there are regenerative properties in this product. They do, like platelets, contain growth factors that can produce healing. But the fact of the matter is, the dosage, the amount of growth factors that's in this product is a fraction of what's in platelets. And despite this, the price of this product is usually 4 to 5 times higher than platelets. Other things to consider with this product is that many of these procedures are done in chiropractic offices, typically without guidance, oftentimes by PA or a nurse. And again, these are dead cell products, more expensive than platelets, yet less potent. Now, one of the marketing hooks that they oftentimes use is, they try and get people to believe that their stem cells are just simply too old to be of any good. Now, our research, as well as other research out there, has proven this not to be the case. There appears to be no correlation between the age of the patient and success with this treatment. In fact, I've treated somebody as old as 97 years, and they've done quite well. Now, as you're doing your research regarding this treatment, understand that there's several red flags to be wary of. First and foremost, any clinic who's offering heavy discounting or emphasis on financing, this probably is a red flag. It's more of a hook than anything else. Furthermore, there are various clinics out there who offer this magic cure-all, who make people believe that their product can cure anything under the sun, from peripheral neuropathy to brain tumors or MS. Let alone, you know, not only do they tell folks that they're treating all these issues in addition to orthopedic issues, again, oftentimes they're not even a specialist in any one of these areas. They also make people believe that everybody's a candidate. In fact, many of these clinics don't even offer an evaluation. They just simply say, oh, of course you're a candidate. Come on in and get the procedure done. And again, anybody who's offering amniotic or cord blood and calling it a stem cell is essentially fraud. And then finally, clinics who are offering fat as a stem cell product. Right now, this product is still illegal because of the processing required. So again, as you're doing your research, one website that I did come across that I find and would highly recommend all of you checking out is this webpage. I invite you to write this down, www.stemcellreview.com. And this has proven to be a very unbiased source. And what they have done is they have given a report card on all the various clinics out there offering this treatment. And they'll grade each and every clinic on whether or not they're using guidance, or they'll grade them on processing, or whether or not they're a specialist, or even things like their web page. And again, I feel it's a very powerful tool in your research that can give you, again, a very unbiased idea on various clinics. So in summary, this technology has been proven to be a very effective means to get people back moving again and get them back to doing the things they want to be doing without the advent of surgery. Regenerative medicine combined with interventional orthopedics, we have found in our hands to be a very powerful tool for achieving this goal. Regenix is far different than any other clinic out there for the number of reasons that I mentioned prior. First and foremost, in large part because of their commitment to the research. And then finally, be aware of the magic stem cell approach. Now, we'll spend the next several minutes just going over questions and answers. I just wanted to leave you with this. If you cared, if you have any questions regarding anything that we've discussed tonight, or anything about regenerative medicine or interventional orthopedics, please give us a call. Our numbers is listed there, as is our website. Or if you want to take the next step and see if you might be a candidate, please feel free to call us. We have very talented educational specialists, namely Dana Marie Texera, who can address your questions and again, get you scheduled if you want to see if whether or not this might be an option for you. So thanks all for coming tonight. Really appreciate it. And we'll take some questions.